I know we have, this is a kind of a closing conversation here, but one of the concerns always is that we learn a lot of information, but we don't always process it. We don't always figure out what does it really mean and what kind of takeaways do we want to have after we've spent all this time learning from all these different folks. So again, with the appreciation for the flexibility in the schedule, with the senator coming in, this was a way to just put together some of our panel members. And I was going to ask them a question because now they're listening to each other. And as they've been listening to each other, they've been learning from each other. Maybe some things, maybe not, we don't know. But I was going to ask you, what did you learn today that you didn't know when you got here?
Oh, well, I'm always learning as a student of the industry. One of the things I learned today was the Dr. Nielsen this morning, that unique partnership, a prime example of the healthcare ecosystem coming together, an employer, a payer, and a provider in order to provide better outcomes for patients at a lower cost. I mean, he was talking about a $4.5 million spend that they've cut by roughly 1.7 to potentially 2.4 million for this employer. That's real money for somebody, and I think that's a great example, so hopefully they'll do a case study on that.
Well, I got here a little late this morning, approximately noontime, so I missed the early morning sessions, unfortunately. I think there was some good information there. As this gentleman, I'm always learning something new. Every time you attend one of these sessions and talk to other people, it just gives the opportunity to span multiple, whether it's healthcare providers, healthcare consulting groups, opportunities to work with placement agencies, anything. You're always learning when you're at these sessions. I think healthcare is one of those uncharted areas. We're growing. We're way behind the financial sector. We're behind manufacturing and some of the things they've done because we deal with people. We have to deal with people's lives, and we can't just ram change in and say, well, it's going to change a widget. It's not that way in healthcare. You're dealing with people's lives, and you're always trying to improve upon that. Not an excuse for being behind. I think we have a lot of work ahead of us. And I think there is certainly a lot of people have a path for the future and some new work that's got to go on. So I think sessions like this are always enlightening for me because I always walk away learning more and meeting new people that I think are beneficial to my career going forward.
The audience has diminished and we're shrinking slowly. I think the biggest thing that I keep relearning at these sessions is the importance of collaboration and how the different aspects of the health system have to absolutely work together. And I think the example that you gave with Dr. Nielsen, in a very local environment, reducing costs for one employer in a collaborative effort with an insurer, I think that is. We can, and again, I said earlier, we can do all kinds of stuff in Washington and we can do stuff at the state level, but healthcare is local. And if we don't take, and if the big plans and the large health systems don't take their initiatives to the local level, I think that'll be a huge failure. And it's really working with the individual patients and learning what their preferences are, and working with individual employers and educating and teaching them, and working with them to reduce their own costs, because it was interesting to hear that infant weight, birth weight, was a major issue in another state, and that just reinforces for me that healthcare is so local, whether it's the state or a community or a region. That is the key to solving many of the problems.
A couple practical things, John. I really liked your conversion program of the MDS into CCD. We're all about coordination of care, and that's so critical to be able to take that kind of data and be able to reuse it. So I'll be knocking at your door for that. The other piece was the Medline Plus or Connect piece. We have a provider portal or a member portal, and being able to provide that information and utilize that would be great. We were just having a discussion, however. I think Medicare requires a 4th grade reading level. You have a 5th grade now, but you're going to take care of improving reading levels in Pennsylvania for us so that we can increase that. And a lot of other great tidbits today.
Hi, I think that one of the things that I'm always brought back to is something when I'm at these health IT things is that healing is a matter of time, but it's also a matter of opportunity. And I think Hippocrates said that. And I think that when you think about that, we are at a point in time where there are tremendous opportunities to improve things for patients with health IT. But there are also opportunities for us to maybe go down the wrong path. And we should think about that. We should be considering the patients when we move forward and what we're doing and how we're moving forward with things. One of the other things I thought was interesting, I also enjoyed what you talked about. And I'm going to go back to the office and see if our healthcare provider is hooked up.
Thank you. Yeah, that's one of the things I did too. When I first started learning about Medline Plus and Medline Plus Connect myself, was looked in my own patient portal, and it is not in there. So, but my personal patient portal is not that robust. But I hope they soon beef it up. One of the things that I always take away from meetings like this is all of the key players. There's so many key players, and there's so many vendors, the HIEs that exist, and I think it's really important to have collaborations like this to talk to one another, so people aren't just going off on their own and doing things and reinventing the wheel. It's so important to collaborate and just work at the same level together.
Thank you. One of the things that we forget about is that we always talk about this healthcare system, but now that it's becoming part of the consumer engagement, we have to recognize that we are part of we are consumers. We are patients. Some of us see this very acutely with mothers and fathers or sons or daughters or whatever. And now it hits home. And a lot of times we talk about it over there. So I'm going to ask the panel here, as consumers, and some of you have spoken from that point of view, what do you expect in the healthcare system as a consumer? We'll let it go down this way.
Okay, I can start. As a consumer, I expect that my questions will be answered. So when I have a question about, I have condition X, I just want to be able to quietly learn about it myself. The whole patient portal thing is fascinating to me. As I said, the patient portal I currently have does not have that availability, and I really want that. I want to be able to go to my own computer and just read about what I have, and then have a system where I can follow up and ask questions, share that information with my family, but just have that way to figure out on my own. Because when you're in a doctor's office, I know I personally, if they're talking to me, I zone out. I don't think about all the questions I want to ask at that point. I'm a processor. I need to go back and read about it, do some research on my own, and then I formulate those questions. So as a consumer, for me, it's important to be able to go back, process, read about, know where to go to read about it. I don't want to be on Google and finding things. I want to know, have that specific information targeted for me, and then be able to formulate questions and have that feedback and conversation.
I guess as a consumer, what I really look for, and I think I've spent a lot of time with doctors and nurses and different people over the past year, I want someone who sees me. I want someone who doesn't see that they need to change the IV bag. I want someone who sees me. And I think that there are times that we miss that. And I don't think that health IT should be encouraging people to move faster and not see their patients. So that's what I look for.
Yeah, I think I've been fairly blessed with pretty good health. But I do need to, go to the doctor every once in a while. I want convenience, What's going to get me to go to the doctor more frequently and when I need to is make it really convenient for me. So whether it's technology, whether it's processes, whether it's getting the right people, doing the right kinds of things, I want the system to be convenient. And I think that's key for a lot of folks because we're busy. We expect from our through our banks and our, other consumer engagement activities with other institutions, a lot of convenience. I think we got to make healthcare more convenient.
Some of you may remember the last meeting I was here, a couple of meetings ago, I was here in a sling and basically a shoulder immobilizer. So I, like Jennifer, had a little more contact with the health system than I would like to have had. Having said that, many of the things that she talked about resonated with me, but my expectation of a health system in the future, and this is a challenge for the vendors in the room, because one of the new things that was interpreted, and this question was asked earlier and it didn't spring to my mind, but one is the ability to isolate a private paid visit. So when somebody looks at my record, that unfortunate thing that I caught in Vegas last year, would be nice if I was able to pay for that privately. It doesn't affect my overall health, and that's not available on the HIE. Thank you. I'd like to keep that quiet. But the rest of my chronic diseases and all of that stuff, it's okay. You can have access to that. So if there's something that I'd like to see, one, I'd like to see an HIE really work, where every time I go into a doctor's office, I don't have to give them my name, my address, my allergies, my past medical history, my list of medications, and everything over and over and over and over and over again. Wouldn't it be nice if I could just sign in and get that done? So that's what I'm asking. But I also want that unfortunate incident in Vegas not on my record.
Sorry, it's on there. We just won't disclose. But I think just reiterating the points that my colleagues have made, convenience, really, really important. And the ability to get data from going to your provider or going to the healthcare institution, having the data available from prior episodes. To me, that's the most annoying because I know it is something that's available, but a lot of places haven't gone there yet. But I think that's in the works. So I like the convenience of just going to a portal and asking questions of my provider and getting information. If I just have a cold and I need an antibiotic, I don't want to have to go into the office to do that. I'd prefer to just email a physician, explain my symptoms, tell them mucus is yellow or it's clear, and boop, boop, it's done. And then he prescribes it off to my pharmacy, and I just go over and get it. So that's what I like.
I love the role of the physician as you just go there for a second opinion. I think I take it from two from two perspectives. The first one is, as Jennifer put it, and to steal a quote from Dr. Paul Grundy, is you want your clinical team to be the role of a healer. The data's all there. You want them to care about you as you when you're in the system, not just as a transaction or someone you have 15 minutes with, or you're changing an IV bag because then you got a patient you got to move down the hall because of pain meds, things along those lines. But I think the other piece, and maybe because you talked about the rural community you serve, John, is I don't live in a rural community. So as a consumer, I want transparency. I want to know why a knee replacement at Mass General is $28,000, but a knee replacement at New England Baptist, who's an orthopedic-only hospital in Boston, is only $18,000. And I want to look at quality, and I want to choose, because I happen to live in an urban environment with Stewart and Partners and Care Group, all in my backyard. So, and we've moved predominantly. The other thing we did at IBM is we moved to these, the flexible spending accounts, but a high deductible type of plan. So now it's my money. And I do shop for most things ad nauseum. It annoys my wife before I buy anything. I will do the same for certain things of healthcare. I need to have a shoulder procedure myself. And I'm now looking at which way I want to go from a quality and cost perspective before who's going to do my shoulder surgery.
Thank you. And one last question as we conclude. We've talked today a lot about advocacy, policy, education, different perspectives. So what needs to be done next?
That's a loaded question. I think leadership is the key, and I think when you look at Delaware Valley, Central Pennsylvania, and Western Pennsylvania all coming together for the Advocacy Day with one clear message, because as you heard when the senator came through, he's got a lot on his plate. He's trying to balance all kinds of things as running a state. When you have a clear message, and that's leadership. I think leadership from groups like this. I was privileged to be part of the New England HIMSS board for many years. I think leadership is the key. and a clear message. And it sounds like we're all going for the same asks around for these various chapters.
Yeah, I think that's something that we've been able to accomplish this year, and we just discussed that at this meeting today, that we want to get together quarterly and continue on and make sure our leadership message is clear, it's succinct, and so from an advocacy point of view and perspective, again, I'll reiterate, HIMSS is an educational wing. It's not a lobby group. It's not trying to push anything through legislative initiatives. It's there though because, like Senator Vlahovic, who we've met with in his chambers, he has a lot of questions. He'll be honest with you. He's very transparent and says, I really don't understand this. And so he did go out to UPMC and the Children's Hospital in Pittsburgh, and he did see, the telemedicine in real live action, and was really impressed with the technology. That's a great start. That's one sector of what we're talking about here. But I think it was pretty monumental for the three groups to come together and have one platform. Because everyone recognized that those are areas that are pretty deficient. Are there others? Sure, there are. But I think we're looking at that as a beginning point. But what's really important is that we as HIMSS continue to meet regularly, build on these relationships with colleagues that we've developed, and I think continue to move this agenda forward in a very positive, transparent way.
Well, as a clinician, I have to say, I think the most important thing we need to do in the next few years is payment reform. I think a lot of the problems that we're trying to solve today are created by a system that has paid for volume, not quality. And if we can figure out a way to smoothly move from payment for volume to payment for quality, most of the problems that we're trying to solve will go away. Because if we can reorganize the health system so that primary care is paid appropriately for the services it's provided, and procedures are not reimbursed multiple times higher than the amount of time it takes to sit down with a patient for 15 minutes, when you can do a procedure in 15 minutes and make 10, 15, 100 times more money, that's a problem. The primary care physicians, and I'm biased, I'm a family doc. Primary care physicians have been driven to volume. They've been taken out of the hospitals. They've been taken out of nursing homes. They've been taken out of all the places as a family physician that they used to go. And that has created more problems than it has solved, in my opinion. Transitions of care, medication reconciliation. I said when I was in practice, I didn't need medication reconciliation. I knew what the patient was on because I had them in the office. I took care of them in the hospital. I took care of them in the ICU, and I took care of them in the nursing home. All of the problems that we talk about trying to solve today would go away if we would reimburse primary care doctors to do what they used to do. And believe me, I would love to be able to sit in my office and talk to you over a webcam and look in your ear and prescribe you an antibiotic if you need it.
I think around advocacy, I would say, and we talked about this early on, and maybe lost a little sight of it, and maybe it's something to bring back, which is always put the patient first. It's all about patients. It's all about care, and it's about getting that child in for a well child visit, which in the process we do discover something does need to be done, and the child is cared for, and so forth. And by the way, the reason we know that child needed to go for that well child visit was because we had a system that could alert. Okay, and we're not first and out. We shouldn't be out in front too much. It's what we support and the change in the access to quality care that we support through our systems that needs to be out in front, and then the rest of it will come our way.
I think that we have a communications and a marketing crisis. I think that we have not done a good job at letting people know and understand why HIT, HIE, EHR, EMRs, and the other multiple letters are important to them. I think until you do that, you won't have a groundswell of patients that are demanding that things change. And I really believe that we have not done a good job at that as a healthcare community. And I think if we do a better job, what you will have is people that are interested, thoughtful, caring, that get behind it and help push it where it needs to be. That's what I think needs to be next.
Just to follow up on that, I agree. To promote this whole community where the patient feels empowered to know about themselves and not rely on anybody else, because and the whole trust of the healthcare system, I think, has failed. And I really think it's important for that patient to feel, me as a consumer, you as a patient, to feel empowered, because it's your right, it's your health, to take control of it and to question what your doctor does, to feel empowered to look, to know about your condition and to ask questions, and not feel like you did something wrong or you offended them because you asked and because you wanted to know more.
Please thank our wonderful speakers and panelists today for their excellent insights. They've been phenomenal.